did some investigations, took some bloods, and then obviously I was then told that I had type 1 diabetes.
Hi everyone, welcome to our first podcast. Today we'll be talking about diabetes. I'm Phoebe Crossler and I'm a content creator apprentice with HMR Primary Care Academy. Today we have Emma Fenwick, and would you like to introduce yourself?
Yeah, of course. Hi, so my name's Emma. I'm one of the diabetes specialist nurses for the Integrated Community Diabetes Service, and that's across Heywood, Rochdale, Middleton and Bury. And I also have type 1 diabetes, so I'm happy to come and talk today.
Right, so today basically we're just spreading awareness about diabetes. So I've got a couple of questions for you, Emma. I just wanted to ask about, when did you first discover you had diabetes and how did you know?
Okay, so I was about 39 at the time, and I started with symptoms of thirst, getting really tired, nodding off at work, which is never a good thing. At the time I wasn't nursing though. So nodding off at work, blurry eyesight. I was also getting some numbness in my shins as well, which I think is a bit of an unusual one. But I was also getting really hungry, so I ate lots and lots all the time, but yet I was losing lots and lots of weight. So I dropped a lot of weight quite rapidly over probably a period of a couple of months, really. And so that was a bit of a giveaway that that my blood glucose levels were quite high, and that I had type 1 diabetes. So I went to see my GP, and they did some investigations, took some bloods, and then obviously I was then told that I had type 1 diabetes. One of the blood tests that they did was a HbA1c, which is the blood test that tells you what your blood glucose levels are over the last 2 to 3 months. And mine was very elevated, so I then had to go to hospital to be started on insulin and just have general checkups and things. So, but yeah, that's how I discovered. Now, within our team, though, a lot of the time we try and help people who are newly diagnosed with type 1 avoid going to hospital, so we can manage them on the community if they've just been newly diagnosed, and we can do insulin starts on the community now and give them all the advice that they need. So I think that's quite nice that it's taking away sometimes that step of having to go to hospital. A lot of the time we can just deal with it.
So since you've had type 1 diabetes, what lifestyle changes do you think you've had, like in your diet, sleeping, mental health?
Okay, so dietary wise, now I can carb count, so I can calculate how much carbohydrate I'm having, and I can match that with my insulin doses. And most of the time that works quite well. Sometimes your insulin sensitivities can change a little bit, and so you have to make some adjustments then. But most of the time, being able to carb count makes a massive difference to how you manage your diabetes and your control. It really helps you to take charge. Lifestyle-wise, I mean, I initially I thought I might have to make some changes, but now I know that really I can do really whatever I want to do. I mean, I've been co-steering, I've been climbing, I do all sorts really. I used to run, I've done long distance walks. So there's always a way that you can manage different things, and that it shouldn't hopefully impact on your lifestyle too much. It makes it a little bit more complicated, and you have to make adjustments and ensure you've got certain things with you at all times. But generally, it shouldn't stop you doing anything. It's just all about managing it and managing any risks.
I was doing some research about diabetes, and I've heard about a 3 a.m. phenomena.
Oh, the dawn phenomena?
Yeah.
Okay, so the dawn phenomena can happen to people with type 1 diabetes. mainly because what happens when we're sleeping, we don't know exactly the mechanism of it, but we think that what happens is we release cortisol and growth hormone in the night in the early hours of the morning to help us prepare our bodies for getting up in the morning. But the offshot of that is that it makes you more insulin resistant. So if you've got insulin in your system, and because you're more resistant, so you're not as sensitive to that insulin as you were a few hours earlier, then you can get a blood glucose rise. So sometimes some people with type 1 diabetes will see a blood glucose rise in the early hours of the morning, and then when they wake up in the morning, they might find they've got a high blood sugar, which can be a little bit disappointing, and for some people can be very frustrating, because obviously they're really trying to get good blood glucose control. So there are ways to manage that, and sometimes if you're on insulin pens, then it can be that you need to increase your background insulin rate, but if you're on a hybrid closed loop pump, then you can always look at when you have that blood glucose effect, when your blood glucose is rising from your sensor, and you can see when that's happening, and you can make adjustments to your background insulin rate so that you've got a slightly higher background insulin rate going in, and that can help you manage that rise a little bit better.
Would you say diabetes can have an effect on your mental health?
So yeah, I think for a lot of people, diabetes can really affect the mental health, because it can be such a challenge to manage, and they can feel a lot of pressures from trying to manage the diabetes. You're always trying to get the best blood glucose levels that you can, and I think sometimes that can get a little overwhelming, and so from a mental health perspective, it can make you feel a bit low if you're not achieving good blood glucose levels, or if you feel like you're just not managing it very well. And it might be that you are managing it very well, it's just that there's lots of other things that are complicating issues and causing you more problems to help you manage your diabetes. And I think it's really important to remember that there's lots of things that will impact on your blood glucose control. So it can be anything from your hormone levels, if you've had a drink of alcohol, it could be the heat. So if it's like a particularly hot day, that can affect your blood glucose levels. There are so many things that can impact on your blood glucose level that you've got to remember that it's not so cut and dry that you put that insulin in and your blood sugar will go to a normal level, or you will stay in that normal range. There's lots of things impacting that's going to affect how well you can manage your blood glucose levels.
Is there any, did you join any groups when you had diabetes, obviously to help you out with advice and anything like that? Do you think there's anything around here for people? So apart from doing the Daphne group, so the education group that helped me manage my diabetes a bit better, I didn't particularly tap into any groups, but when we see people with type 1 diabetes in clinic, we will always ask about the mental health and see how they're getting on, because it affects everybody so differently. And so some people may be fine and quite able to manage, and it's not affecting the mental health too much. But for others, because it is so challenging, they might need a bit more support. And that can be offered through Mind groups.
Yeah, so mind, talking therapies, that sort of thing. We've got plenty of support within the area, so you can be referred, or you can self-refer to those as well. And we always try and broach it in a clinical consultation, because obviously we're so aware that diabetes and mental health is a very strong link, and so we know people are likely to need a bit more support.
I remember you saying that you got diagnosed when you was 39. I was going to ask about if it had an effect on your family, but you also mentioned that people with type 1 usually get diagnosed when they're younger. So as a child and growing up with diabetes, how do you think that would affect them as a family and what changes would...
So for younger people, I think a lot of the challenge that families might get as well as the young person with diabetes is the frustrations again of managing glucose levels. Obviously young people want to be active and do whatever their friends and their peers are doing, and so again it's a lot of it's about education and learning how to manage it, so you can just go and do whatever your friends are doing. But it's also about, I think a lot of the time young people are quite nervous about talking to their friends about it and wondering what they'll think. And family, on the other hand, family might be very worried about them because they're worried about them having hypos in the night or hypos at school, and how that's going to be managed if they're not there to sort of look out for them a bit. So I think a lot of the technology that we've got helps parents and the young person with diabetes manage that a lot better and manage those risks and those concerns a lot better.
Right, so now I want to go on to talk about stigma, and what I wanted to ask was, what is stigma and why can people with diabetes struggle with it?
Okay, so stigma with diabetes is generally people having sort of negative or negative attitudes or understanding of what diabetes is, sort of buying into a lot of myths and misconceptions of what diabetes is. And so it might be that somebody might make an offhand comment or sort of say, well, you can't eat that, can you, because you've got diabetes, or you can't do this because you've got diabetes. So it's those assumptions and buying into those misconceptions and myths, really, that
I feel like
sort
that
of fuel stigma.
Yeah, I feel like that could happen quite a lot, because I've known a few people that have had like diabetes and they've said, and they've had like a chocolate bar but only like a little one. It's like, well, can you eat that? And then it can kind of make someone feel a bit uncomfortable, like obviously I can eat it, or I can only eat a certain amount, but it's not really.
Yeah, because I think from the person with diabetes, from their perspective, it can make you feel like people are sort of questioning and looking at, making
watching
that judgment about what you're eating, and that's, you wouldn't do that to somebody who didn't have diabetes. So why would you do it to somebody with diabetes? So
And I wanted to ask, like, what advice would you give to someone who has diabetes and has been struggling with stigma?
So if they're struggling with stigma, I think it's quite challenging, really, because from the person with diabetes, from their perspective, how do you broach that stigma? What would you do? A lot of the time, the stigma comes from lack of, just not having the education, and so we can always point people into towards like Diabetes UK, which is a really, really good site. They've got an excellent website with lots of supporting education for people with diabetes and for their family and friends. And there's a lot on there actually about stigma with diabetes. So that
can help them out if they look on there.
That can really make a difference, absolutely. So they can point towards that. I think also, you see, the problem with stigma is that because it can happen quite often, so it can happen anywhere, at home, in the workplace, when they're out with friends. So it's
kind of hard to ignore.
Yeah,
sometimes.
I think sometimes you feel like you've got to educate people all the time. And so that's why sometimes if you're getting a little bit fed up of having to sort of educate people about what you can, that you can eat these things and that you can do these things, that, it can get a bit tiresome for them, really. So if they do need that extra help, just to point them in the direction of websites and things, just so they can sort of
get some advice,
take a seat, really.
And I was going to say, what ways do you think you can reduce stigma? But like you said, websites, research, maybe people educating themselves.
A lot of it comes down to education. There's a lot of research going on certainly that's being done by Diabetes UK into stigma. And I think sort of if you can educate your friends and your family, then you've got that supportive, that to support you too.
Yeah.
So you're not having to explain yourself all the time. And I think sometimes it's a case of, if you can't educate them, maybe just thinking it's fine. We can, you can deal with it in maybe a different way. You can chat about it in a different way, or you could just ignore the behaviour. From a personal perspective, I don't really encounter very much stigma. I do see it in clinics sometimes, some relatives, because they don't have the understanding of diabetes, then you can see a little bit of stigma there. But again, it generally is all it comes down to education and just educating people about diabetes.
How would you say this affects people socially, and what can it lead to?
Yeah, so affecting people socially, I think for especially for young people and older people, there can be nervousness around if they're on insulin pens and having to inject their insulin or bolus from their pump. I mean, certainly I remember when I was first diagnosed, I went out for a meal and I was like, where am I going to inject? What am I going to do? And so I found myself going to the bathroom to inject my insulin, and then I thought about it. I thought, why? Why am I going to the toilet to inject my insulin? A, it's probably not the most hygienic place to be injecting insulin, and B, I shouldn't be ashamed of this. I shouldn't be worried about it. It's something it's a condition that I have to deal with in the day-to-day life. So from then on, I just thought, right, okay, I can inject when I'm at the table, which is what I did. And I never had any issues. Nobody ever questioned me about it. But I can see that for some people, that could be quite a scary thing to do. They may get some comments, some negative comments about doing that because of the connection with injecting in a public place, and that could be seen as, and the relationship with maybe sort of illicit drugs. But at the end of the day, it's your insulin. This is your sort of lifeline, basically. And you just need to explain to people that this is insulin. It's not a. You
can't really help it though, can you? If it's for your own health.
Absolutely.
And I think, like you said, people should educate themselves and
Yeah.
become more recognisable with it and used to it. So if someone's constantly getting like stigma and like people are saying things to them and constantly like targeting them, or they're feeling targeted, what would you think this could lead to, this like for the person with diabetes?
Yeah, I think for the individual it can certainly lead to things like depression, really low mood. It might stop them going out socially as much. And this is the shame of it really, because it's so unfair that somebody who, yes, they've got this condition, but really they should just be able to lead a normal life. And if they're so worried about the stigma and if they're getting lots of issues and judgment and things, then it can really limit your social life and your lifestyle really.
And one last question that I wanted to ask is, if you're a younger person and you go out a lot and you're drinking alcohol and you're dancing, what advice or what effect can that have on that younger person if they have diabetes? So alcohol can affect your blood glucose levels, and depending on what you're drinking as well. So if you're a beer drinker, because there's a lot of carbs in beer, so it can make your blood glucose levels rise very initially. But then later on in the night or in the early hours of the morning, you can find that you get quite a drop in blood glucose level, because alcohol itself can make your blood glucose levels drop. It makes you very sensitive to that insulin in your system. And so if you're out dancing as well, and you're burning off energy, again, that can cause your blood glucose levels to drop. So it's all about, if you're, you have to make sure you're having a meal before you go out. So eat really well,
maybe don't have as much of your mealtime insulin, just so that you can manage any drops a bit later on. And I'd always say always have a snack before you go to bed. So about a 20-gram carbohydrate snack, whether that's going to be a couple of biscuits or some toast, or a banana, something like that, just to help keep your blood glucose levels up overnight. And I think if you're having alcohol and you need to go to bed with your blood sugar a bit higher as well, because obviously if you're going to have a bit of a drop in the night. Other things to help as well would be if you're on a sensor, your sensor can alarm when your blood glucose levels are dropping, so make sure you've got that low alarm turned on. If if you've got any family linked up to your alarm as well, that's a good thing, because sometimes if you've been out at night and you're really tired and you've had some alcohol, then that can sort of make you sleep a bit more deeply. You don't always wake up to the alarms as much, so it's good maybe to have somebody else linked in on your alarm as well in those situations. So definitely do all those things if you're going out, having a dance and a drink. Make sure you do eat well, always have a snack, and just make sure your blood sugar's not too low before you go to sleep.
Thank you for tuning in to today's episode. We really hope you enjoyed it. If you enjoyed it, please share it with others and follow our social media at Rochdale Health Alliance.